very much, and it's very good for the fever. Helps to bring down a fever. Hot ginger tea, 2 cups of water, a tablespoonful of chopped ginger root, fresh root, or half teaspoon of ginger root powder. That can be used to brew the tea, and then you simmer it for 15 to 30 minutes and give a tablespoonful at a time to a small child. A little more, maybe even up to 1/3 of a teaspoon, 1/3 of a cup for an older child. Very good remedy. Ginger, of course, is anti-inflammatory. It also will tend to raise the skin temperature, which then brings blood to the outside by dilating blood vessels on the skin, and then allows the body to dissipate some heat. A cup of wintergreen herb tea or white willow bark tea is also very good for childhood fevers. For a child, brew a cup and give 1/3 of a cup during the day in 3 divided doses or 4, and give the child the tea throughout the day. Now, wintergreen herb is different from, it's a little low-growing plant with red berries. You can see it here. It grows at Uchee Pines, and it grows here, and you will probably find it in your area as well. A beautiful little low plant, maybe 4 to 6 inches tall, in the wintertime or late fall, has red berries. And that herb is different from oil of wintergreen, which is toxic to children, so don't be confused about that. Okay, let's talk a little bit about asthma in children. I think probably the best treatise of that I know of is for children. Asthma in childhood is our book called Natural Health Care for Your Child. Phyllis Austin did the library searching for information on childhood asthma, and the section in that book that Phyllis got together is really quite good, and I like it very much. Asthma, of course, is a chronic inflammatory lung condition, and it causes difficulty in breathing, especially breathing out, and tends to have flare-ups. The bronchial tubes become inflamed, and the muscles that surround the bronchi become contracted, and the mucus, which is produced in excess in asthma, becomes dried, and that further narrows the airways. And untreated asthma, that is asthma that you do not try to prevent when you're between flare-ups, that may have flare-ups that can lead to such a severe state that the child has to be hospitalized, and of course deaths can occur in the severe asthma flare-ups. We're having an increase in the death rate in asthma, not only in childhood but also in adult asthma. And it's believed by those who are studying this situation that it's the medicines, the modern medicines that are being used, that increase the death rate in these cases. Now, some causes of asthma, and this you want to search out very carefully, because your success in doing this may determine whether the person will have flare-ups. And it's caused by a variety of factors. One is the allergic condition, an allergic condition that arises from a number of things. Maybe bacteria that grow in lungs, particularly lungs where atelectasis or bronchiectasis has occurred, as in whooping cough, untreated and neglected, can result in an allergic condition to germs that have their dwelling in the lungs. But of course, reactions to food, drugs, perfumes, dust, moldy houses, and other irritants Foods which are most often allergic reactions come from are wheat, eggs, milk, chocolates, beans, and all legumes, potatoes and all nightshades, pork and beef. Quite often, however, it's triggered by a combination of both allergic and non-allergic things, such as emotional tension, the weather, air pollution, and hereditary factors. So a person who is, let's say, allergic to house dust won't have a lot of problems until the severe emotional upsets that come with, let's say, the little cousins come to visit, and that causes the child with the allergy to house dust to have a flare-up. And so mom, who already has a little extra stress with the company, now has extra stress with a flare-up of asthma. And that can often happen, that the emotional input is the thing that causes the problem. You will see here SM for smooth muscle. This is a little mound of smooth muscle here and here. And here is the lining of the bronchi and the trachea. And here is where mucus is produced. And with the irritation of house dust, it gets on the cells right along here and transmitted to the cells through the fluid part of the mucus. The cells react, produce more mucus, which with the rapid breathing that they may be having causes drying of the mucus, and then it builds up and becomes tough and difficult to expel. Now, if you give the person garlic, then through the blood vessels that feed this epithelium from down here, the garlic is excreted here through the lungs, liquefies the mucus, and assists the person in coughing up the mucus, and of course that improves the person right away. And I'll have a bit more to say about that in a moment, but this gives you an idea of how it is that the anatomy here is the subject of the asthmatic attack. Now let's take the matter of garlic. Take a cup of water in a blender with 2 to 5 cloves of garlic and blend them until they're well blended. And at that same time, prepare a second cup. This one is the deluxe cup, and you put a cup of canned tomatoes or tomato juice in the blender with 1 or 2 cloves of garlic. Salt it to taste and make it so that it's very nice, and set that aside. Then you offer the patient the first cup that has the heavy garlic dose in it, and you say with a little bit of authority, drink this down quickly. And if they drink it down quickly, some of you know what is going to happen next. Then you prepare for a vomit. And that can be a trash can lined with a plastic bag, and have that close by, because you're hoping that you will need that shortly. Now, as soon as they have vomited and they have stopped vomiting, then you offer the deluxe cup. And that one you want to stay down, so have them to sip that. Now, pretty soon the garlic will be excreted through the lungs, and that does the work of liquefying the mucus and helping the person to cough. So that often, within moments of going through this little routine, you can have a person who is breathing better. Now, more treatments. Turmeric is a good one. Turmeric contains curcumin, which is valuable in asthma. The patient should be given a teaspoon of turmeric powder with a glass of water 2 or 3 times daily. Now, you're limited in how much you can give by the fact that it can irritate the stomach. If it irritates the stomach, then you simply back down from this size dose. instead of giving a teaspoonful, you may give half a teaspoonful 2 or 3 times.